Hey all. So this is a relatively short video because I want to focus on diabetes in particular as the last dynamic of endocrine disorders. So to do that, I first have to introduce you to the pancreas. Now I know we've already talked about the parathyroid and the thyroid and the cortex and all this other kind of stuff. So you feel like you've talked about all the components of the endocrine system. The pancreas is one more of those components. And here's an image of it, and you can see there it's around the mid to upper abdomen, just under the stomach. And it has a lot of different purposes to it, and that's why we don't think of it as just an endocrine organ, because while it secretes insulin, it's also involved in other aspects of digestion. It secretes different kind of gastric juices and other sorts of things. So it's a critical organ that's important in all different aspects of the digestive system. But one of the things it does is it secretes insulin. And it does that from basically little nodes, little what are called islets in the pancreas, little dots in the pancreas that aren't very big, that secrete these insulin hormones that then get released into your circulation and therefore end up allowing your body to absorb glucose. So how does that work? First, a quick reminder, glucose is your body's preferred fuel. It is the energy source that your cells in most of your organs, or in all of your organs and all of your tissue, are using. So when you eat food, your glucose level goes up. When you haven't eaten in a while, your glucose level goes down. Your body is able to, or your pancreas, I should say, is able to manage this by identifying a high glucose level and releasing insulin when appropriate. It can, by the way, also sense a low glucose level, and when it does, it's going to secrete glucagon. And glucagon basically causes the liver to change a stored form of glucose into an available form of glucose that goes into your circulation. So your pancreas is therefore both up and down adjusting your glucose level to keep it within an acceptable range. When it gets too high, it secretes insulin. What does the insulin do? Think of the insulin as a key that unlocks the door. In your cells, there's a door that allows glucose to go into your cells and be used to support the metabolic machinery of your cells. It's the fuel of cell activity. Okay, so the insulin opens the door and allows glucose to go in. If you don't have insulin secretion, you still have a lot of glucose in your blood. In fact, you've got a huge amount of glucose in your blood because your cells can't absorb it. Your organs and your tissues will basically starve, so to speak, because they won't get the energy they need, even though there's plenty of energy in your circulation. That key is not there to unlock the door. Glucagon, again, is secreted by the pancreas to turn what's called glycogen, which is a stored form of glucose in the pancreas, back into available glucose and allow that into the circulation. So if you have really low blood sugar, your pancreas can respond by secreting glucagon to allow your blood sugar to go back up. And you might have low blood sugar, for example, if you've gone too long without eating. Okay, so insulin is the key that allows the cells to open up this door. Certain, by the way, organs are too sensitive or vulnerable and don't require this insulin, if you'd like, or that is to say, the availability of sugar to them is too crucial, so they don't necessarily require the insulin. Like, for example, your brain doesn't require insulin in order to absorb glucose. Your liver, your kidneys, the lining of your small intestines. These are just a few places that, for various reasons, can absorb glucose without insulin. Having said that, the rest of your body, which is critical to your survival. To be clear, you can't survive just with a brain and a kidney. The rest of your body requires the insulin to absorb the sugar, the energy. Normal blood sugar levels, we measure this in milligrams per deciliter. Does that matter too much? Not really, but you should know that normal blood sugar levels are somewhere around 70 to 100. And then if you eat a big meal, maybe within a couple hours, your blood sugar level might stabilize at about 140, 145, something like that. When you wake up in the morning, ideally, If your pancreas is able to manage your blood sugar shouldn't be too far off of 100. So if you wake up in the morning and your blood sugar, for example, is 120, that's a problem because you shouldn't have high blood sugar when you wake up in the morning. On the other hand, if you wake up in the morning and your blood sugar is 30 or 40, that's a problem too, and your pancreas is unable to manage a stable blood sugar for you. But you get the idea here. Your pancreas is basically managing this somewhere between 70 and 100 or so when you're not just after eating, and just after eating it gets a little higher than that, which makes some sense, and then that gets absorbed by all your tissue. Okay, so where's the problem? The problem is in something called diabetes mellitus, or more commonly just called diabetes. And diabetes comes in two forms. One form is type 1 diabetes. And type 1 diabetes is basically the pancreas is unable to produce insulin. This generally expresses itself fairly early in life. So we used to actually call it juvenile diabetes, because basically the only kind of diabetes younger people got was type 1 diabetes, because type 1 diabetes is basically about your fundamental makeup. It's not about any life choice you've made. It's just that your pancreas has this dysfunction and is unable to do this thing. This, by the way, represents less than 5% of all diabetes. So this is not the most common form of diabetes. And you might know somebody with type 1 diabetes because they've had to have insulin injections. So this is an insulin-dependent diabetes, which means that somebody who has this form of diabetes has to pay attention to how much food they eat and when they eat it and what type they eat, and be able to respond by injecting the appropriate amount of insulin. Up until recently, that meant they would sort of have to estimate their blood sugar levels, or I shouldn't say that, pay attention to the food they eat to manage their blood sugar levels, and then maybe measure their blood sugar after a meal, and then inject the appropriate amount of insulin with an hypodermic needle. Now we have little pump devices that automatically measure somebody's blood sugar and then responds with the appropriate amount of insulin. So this is much better. This is something that attaches somewhere around their abdomen and has a little needle that allows for access to the body and the injection of the insulin. So it's gotten much easier to be a type 1 diabetic, but this is still a pretty significant problem because if not managed properly, that high blood glucose is going to cause problems with circulation. It's going to cause susceptibility to infection. So people who have type 1 diabetes and type 2 diabetes, which we'll talk about in a minute, typically can suffer from significant infections. They can suffer from the effects of poor perfusion. It's not uncommon, and certainly was more common in the past, for people with type 1 diabetes to live shorter lives and lose a few toes before they died just because of the poor perfusion led to infection and disease. It can lead to sort of ulcerations or open sores where there's poor perfusion. You get the idea. Okay, type 2 diabetes is a little different. Type 2 diabetes certainly can be informed by some genetic predisposition. So some people are more prone to type 2 diabetes than others. But type 2 diabetes isn't the inability to produce insulin at all. It is basically either a decreased sensitivity to insulin or a decreased capacity to produce insulin. And in both cases, it typically can be worsened or brought on by a bad diet. And you can imagine this, right? I talked about this in the last video. If you're eating a lot of food with sugars, and here I don't just mean like chocolate cake, but by the way, I do mean chocolate cake, but I don't just mean that. I mean like, I don't know, a lot of pasta, which has simple carbs in it. You know, simple, not whole grain, nothing fancy pasta. A lot of rice, a lot of breads. These have simple carbohydrates in them, which are basically sugars. And that raises your glucose level. In fact, people who are struggling with diabetes often talk about the glucose levels in food. So they basically evaluate foods based on the amount of glucose they're going to immediately produce in your body. Okay, so if you're eating these foods with these high glucose index, then what happens is you're putting out a lot of glucose into your system. And you know that there's going to be a down regulation therefore in your target cells, that they are basically going to decrease their response and decrease their numbers, which means you're going to have a lot of sugar flowing through your system, but your body is not going to be as effective at absorbing it into your cells. So your organs and your tissues are not going to have adequate energy, even though you've got plenty of glucose in your blood. The other possibility is the same kind of dynamic, but with your pancreas. That is to say, you put a lot of strain on your pancreas to keep producing more insulin and more insulin and more insulin because you got this diet that's super high in sugars or simple carbs, and the result is that your pancreas gets exhausted effectively, and it cannot keep producing the adequate amount of insulin. So as the capacity to produce insulin decreases, and or as your ability to respond to insulin, your insulin sensitivity decreases, you're unable to do what you used to do. You're unable to basically manage these high glucose levels. So you got this diet that's high in sugars, that's high in chocolate cake or pasta or breads or whatever, and the effect of that is going to be bad. So typically, type 2 diabetes can be or is frequently seen combined with things like excess weight, poor diet, lack of exercise, things like that. So the basic level of fitness is going to help your body basically respond to high glucose diets. So all of these things can kind of create what we call type 2 diabetes. And type 2 diabetes is the vast majority of diabetes out there. And it can be equally problematic. It's not necessarily initially going to lead to insulin dependence. Type 1 diabetes, you've got to take insulin because you cannot produce the insulin. Usually in your late childhood, that dynamic will manifest. Type 2 diabetes used to manifest just with adults because it took a fair amount of time to eat enough sugar, basically, and to have a bad enough diet to down-regulate these target cells to create the type 2 diabetes. What we're seeing now, unfortunately, is America's diet has gotten so bad that kids are starting to get type 2 diabetes. So we used to call it juvenile diabetes type 1 because it was the only diabetes that would ever present with juveniles. Now we don't use that term anymore, in part because kids are getting a lot of type 2 diabetes as a result of a bad diet. And a lot of this, by the way, isn't intentional. Some of it can be processed food. So if you're eating a lot of foods that are prepackaged, frozen, from fast food restaurants, etc., you may not realize it because you don't think of these as sweet, but they have a lot of sugar in them, and that can be part of the problem too. So kids that are raised on a lot of frozen burritos and other kinds of stuff are definitely more susceptible to type 2 diabetes. Okay, the effects of this can be significant. Let's think about some of the symptoms. First off, we often talk about the 3 Ps. Polyphagia, polyuria, and polydipsia. Those words may not make sense to you, but I bet you could figure out what they mean. Poly means many. So miniphagia means you're eating a lot. Polyuria means you're peeing a lot. And polydipsia means you're drinking a lot. Does this make sense? Yeah, because you've got a lot of sugar in your blood. And your kidneys respond by trying to flush that out. That's just way too much sugar. So your kidneys are trying to produce as much urine as possible to get all that sugar out. In fact, here's an interesting factoid that makes you happy not to be a doctor. In 1880, the way this used to be diagnosed is physicians used to taste their patient's urine. And you can taste that the urine is sweet because it's got so much sugar in it. And that's how you knew it was diabetes. Cool, right? So your body is peeing out a lot to get rid of all that sugar. Well, one of the responses to that is you're going to get more thirsty. So polyuria is a lot of pee, polydipsia is a lot of thirst, and then polyphagia is a lot of hunger. Well, why are you eating a lot? Because your body is telling you you need food. You don't really need food. You've got plenty of energy circulating around, but your cells aren't getting it, so your cells think you need food. So you're getting the signal that I need to eat more. So a strong appetite, high thirst, a lot of peeing, these are signals of potential diabetes. In addition to that, of course, you're going to get other effects as well, because this large amount of sugar in your circulatory system is going to potentially lead to deposits over time. That's going to lead to a narrowing or a hardening of arteries. Basically, your vessels are going to be strained by the exposure to this high amount of sugar. That's going to lessen blood flow as well, so you're going to have poor circulation. That can create all kinds of issues, from organ and tissue damage to peripheral artery disease. So there's going to be some problems there. You're going to experience things like perhaps vision problems. Why? Well, because those vessels in your eye are so tiny and sensitive that they're going to be some of the first ones that are going to experience this. You might have slow healing sores. That makes sense. You've got an injury and it's not healing properly because you're not getting adequate perfusion and you don't have adequate inflammatory response to provide healing. You might have unexplained weight loss, for example, because you can't absorb the energy that's just basically flushing through your body. You might have tingling and numbness in your hands as a result of poor perfusion. We talked about ulcerations before. We talk about foot and hand issues related to poor perfusion. As I said, back in the day, not so much now, but still not impossible. A diabetic might experience loss of toes because they become diseased from the lack of perfusion and possible infections. Why do you get so many infections? Well, you've got poor perfusion, which means your defensive system's ability to respond to infections goes down, and you've got plenty of sugar in your bloodstream, which can feed things like bacterial growth, creating a perfect environment for infections. Before we leave this topic, if I haven't scared you enough, let me give you a couple of more significant examples of how this can get really bad. One is called diabetic ketoacidosis. You mightn't have heard the term keto before because keto diets are pretty popular. And ketosis just means that you're not using glucose in your bloodstream as your energy source because there's not an adequate amount of it. To some degree, you are burning fat. So you're taking lipids that are stored in your body and you're using those as an energy source. This is why it's a popular diet. I think you can imagine why. If I can get my body to burn fat, that's awesome, right? That's a good diet. But let's talk about some of the problems with that. When you go into ketosis, you are burning long chains that are called lipids or fats. Here's an image of what one of those would look like. And as you can see, it's a hydrocarbon chain. It's a bunch of carbon strung together with hydrogen all around it until you get to one end. And then that end has a more complex molecular structure to it. So when you burn that fat, when your cells take that fat in as energy, they're going to gobble up that hydrocarbon chain. That makes sense. It's got a lot of energy in it. In fact, that hydrocarbon chain looks a lot like gasoline. Literally, that long chain is exactly the same molecular structure as gasoline. So it's got a lot of energy in it. But then when it gets to the end, the more complex part of the molecule, it's going to leave that behind. That's a problem. Because what it's leaving behind then are called ketone bodies. And those are beta-hydroxybutyrate, acetic acid, and acetone. Now, you may not know what beta-hydroxybutyrate are, but the other ones you might recognize. Acetone is the kind of thing you clean nail polish off with. That's what's going to be building up in your blood circulation. Acid, acetic acetate, that's also going to be an acid. And so is, by the way, the butyl hydroxybutyrate. In fact, the acetone itself is pH neutral, so it's not an acid, but you can imagine that it's reactive and a problem in your circulatory system. So, getting back to DKA, or diabetic ketoacidosis. Let's imagine you have diabetes. You got a lot of sugar flowing through your system, but you're not producing adequate insulin. What happens? The cells turn to fat for their energy source. So now you go into ketosis, just as you would in a ketogenic diet. And the result is you're burning all these fats. Now you've got a lot of sugar in your system, but you're flushing it all out, so you're starting to get dehydrated, not a good thing. And what's building up is acids and acetone in your bloodstream. Can you imagine how this is bad? You know how sensitive your body is to changes in pH, and now you're dropping your pH really significantly. The effect can be catastrophic. You're going to experience compromised cognitive mentation. That is, your brain is going to not function properly because it's not getting adequate energy and it's being exposed to whacked out pH. Your body in general is going to start dysfunctioning. You're going to have problems perhaps breathing. Your heart may start going to abnormal rhythms. You might get really whacked out as your brain gets more and more starved. Some folks in DKA get extremely whacked out. You'd swear they were on some kind of severe altering drug. And in the end, if not treated, this will kill you. The early signs of this, by the way, just as a little interesting note, is that smell of acetone, because acetone has a particular kind of, sweet acerbic kind of smell to it. You probably know this if you've used nail polish remover or acetone as a cleaner or something like that. You know roughly what that smell is. Some people actually find it pleasurable. You'll smell that on the breath of folks that are in ketosis and significantly in people that are in DKA. And the reason for that is your body is trying to flush that out, right? That's what the respiratory system is desperately trying to do to manage your body's pH level, but it can't do it because you have been stupid. So DKA can be a really life-threatening issue, especially for folks, and all ketosis can be. So 2 punchlines there is 1, take care of your body to not develop diabetes because DKA can be life-threatening and it's a real possibility if you've developed diabetes. And second is, don't be foolish and force your body into an abnormal ketosis as a ridiculous way of trying to lose fat. There are better ways to lose fat, like actually a healthy, balanced diet and exercise. Before I leave this topic, let me give you another example that'll just help you understand how the whole body system works. And besides, I can't help myself, right? Which is hyperosmolar, hyperglycemic state. Now that seems like a real complicated term. And if we had begun the term with that word, you would have been like, holy shit, this class is not for me. But now you can take it apart. Hyper means too much. Osmolar, you know what that means. A lot of particulates per unit volume in your blood. So you've got thick blood with a lot of stuff in it. Hyperglycemic, a lot of sugar. This makes sense. The sugar is basically functioning as an osmotic particle, right? So you've got a lot of sugar flowing through your bloodstream, which is drawing fluid in potentially and creating a hyperosmolar effect. This can be a real life-threatening condition that also is connected with type 2 diabetes. It's basically extremely high glucose levels because you've eaten a lot of carbohydrates and your body cannot adequately manage the insulin necessary to allow you to absorb that. So you're going to see confusion bordering on delirium, possibly hallucinations because your brain is not getting adequate energy or adequate perfusion, maybe loss of consciousness. Initially, you might see something less significant like severe thirst, dry mouth. Remember we talked about this before, polydipsia, polyuria, really frequently aggressive urination, blurred vision because your vision is particularly susceptible to this kind of lack of perfusion, etc. You might get into seizures. It might end up being a coma. And in the end, it's organ failure and death because basically you've overextended your body's capacity to deal with this extreme osmotic gradient that you've created by having a lot of sugar in your bloodstream. So we need to be careful about this. Take a look at this graph. You can see here that more than 10% of adults in the United States have a diabetes diagnosis. And then another significant chunk don't have a diagnosis, but have diabetes. Worse than that, or more alarming, is that the estimates are that 1/3, 33% of adult Americans have prediabetes. That is to say, they have conditions that are putting them on the track to diabetes, and without a significant change in lifestyle and dietary choices, they will develop diabetes. Diabetes is now basically a national health emergency, and we need to deal with it. And here's the good news. Dealing with it isn't that hard. It's a balanced diet, avoiding excessive carbo-intensive foods. So that doesn't, by the way, mean go to a keto diet. That means just having more whole grains instead of sort of maybe regular pasta. Have a pasta that's whole grain and take a look at the back of the label and see that, oh yeah, it has less carbohydrates and more fiber. Fiber is useful here because it'll allow you to manage some of those carbohydrates. Maybe, having less bread, maybe having more balanced kinds of foods, maybe having less fast food, less heavily processed foods because those tend to have more carbohydrates in them, and exercising more, which doesn't mean you have to be a gym rat. It could mean you go for a mile walk every day. Could mean you take the long way to campus. If you live in the apartments, when you walk to main campus, maybe walk the long way around the lake. That's all. Just modest exercise significantly reduces the probability that you will develop diabetes. And it creates lifestyle changes that will, throughout your life, keep you healthier and help avoid diabetes or prediabetes. In addition to that, the same thing with balanced diet. So I'm encouraging you to pay attention to what you're eating. I know it's easy as a college student to just sort of survive on coffee and pizza. But the patterns you set now are setting up the terms for later. And it's not much later, because remember, a lot of children are developing type 2 diabetes now. So you, right now, not 10 years in the future, right now are vulnerable to prediabetes and even type 2 diabetes. You want to avoid that because that's going to make the rest of your life significantly more difficult. Okay, that's it for the preaching. I will see you in the next video where I think we're going to talk about neurological issues. Okay, see you then.